Hey guys, I have a quick video. I just wanted to go through Chapter 7 Lifespan Development and do a quick review just for the exam. So this isn't really reviewing the entirety of Chapter 7 Lifespan Development, just a quick review for the exam. Okay, first off, let's start with infants. We've got our separation anxiety, and it's going to peak between 10 and 18 months. So what is separation anxiety really? It's when infants really have anxiety and fear when they're separated from their closely bonded caregivers. So if you take the baby away from the caregiver, they will start crying, screaming, and appear kind of anxious. And this is normal, and we should expect it. So what does that mean as an EMT? Well, when you arrive to the scene, you want to try not to separate the infant and their caregiver if at all possible. Now, sometimes you do. Let's say there's a multi-victim MVC, and the mom is also injured, or the dad, and you have to separate them. That is necessary. But let's say you arrive on scene at someone's house and the baby's sitting on the mom's lap. You should try to do as much of your exam with the mom holding the baby. You wouldn't want to take them away because they could really get anxious and start crying. Try to leave them on the mom's lap and do as much of the exam as possible. When you have to transport, try to keep them together and just keep saying, "Mom's right here, your mom's right here," or dad, whoever the caregiver is. Next is the anterior fontanelle. It fuses between 9 and 18 months. So I have a picture here of the anterior fontanelle. Here we go. So we talked about this in class, how the baby's, the cranium is really made up of these plates, the frontal bones, and here's the occipital bones, and there's an open, these are sutures, and there's an open fontanelle. It kind of looks like a diamond. And it's open because there's such rapid growth in the brain between this period from when the baby is born that the cranium needs to grow. If it's fused at birth and there's no growth, then the brain won't have any room to grow. So it's open as the brain grows, and then it eventually fuses. We do talk about this fontanelle in some assessment areas. We talk about pediatrics. So for example, when we're looking at dehydration, this is one of the indicators of dehydration. Definitely not solely on its own, but if the fontanelle is kind of depressed or sunken in, it could be one of the indicators of dehydration, but it would have to go along with like crying without tears, dry mouth or dry mucous membranes, and diapers that aren't as wet as usual. And we'll talk about that in pediatrics. Another thing is there's an infection called meningitis. It's an infection of the meninges that surround the brain, and it can cause the fontanelle to be bulging from increased intracranial pressure. And we'll talk about that when we talk in medical emergencies. But the thing to know is the fontanelle fuses between 9 and 18 months. So if you're looking at a 2-year-old, that doesn't help. The anterior fontanelle doesn't really help to assess for dehydration or increased intracranial pressure because it will already have fused. Stranger anxiety is between 10 and 18 months, and this is fear of strangers. So if you arrive into the scene and there's an infant between 10 and 18 months with their parent, they should be have a fear of you or have anxiety of strangers. Not all 100% of kids do, but it is a normal development that we expect. Again, stranger anxiety, 10 to 18 months. Okay, next up, we're going to talk about the elderly. For cardiac, we did talk about one of the biggest problems in the elderly or in the aging human is atherosclerosis. And it's a narrowing of the arteries caused by a buildup of fats and plaque. And it really puts a stress on the whole system. It can cause high blood pressure or even heart failure. This is a normal artery with just a little bit of plaque, and plaque does start building up in the teens, but it's fat deposits, and then the body kind of caps them off. And this is a huge diameter for the blood flow to go through and deliver oxygen and nutrients. Here we have some plaque growing, and we're narrowing this interior diameter. And this is a plaque that is rupturing. So we don't know why all the time the plaque ruptures. But if the plaque is unstable and it ruptures here, it's going to call on the platelets. Remember, the platelets call on other angry platelets to kind of form together in a soft clump, and then we lay down the fibrin. That's why we try to give aspirin as early as possible, because we want to try to prevent the platelets from calling all their friends over and forming that soft platelet clump. Or in other words, we want to prevent the platelets from becoming sticky or platelet aggregation. Because you can see when this plaque ruptures, the platelets kind of gather and make a clump. And now look at our diameter. Here we still are delivering oxygen and blood. Let's say this is a coronary artery that's delivering oxygen and blood to the heart. We're still, in this case, without the platelets here, we're still delivering some restricted, but some oxygen and nutrients to that heart muscle that's pumping. And here we've really restricted the diameter. So anything we can do to keep the platelets from clumping and get the patient to the hospital as soon as possible by recognizing the symptoms and getting to the right place as quickly as possible will prevent that heart muscle from dying. So overall, all of this plaque in the whole system does increase blood pressure. When you have an increase in the systemic resistance, or the force that the heart has to pump against, it can weaken the heart or strain it. So what's the biggest problem in the elderly with cardiac is atherosclerosis. It can lead to high blood pressure, strain on the heart, and then also predispose patients to heart attacks and strokes. Next up, renal. Another word for renal is kidney. So what do our kidneys do? They clear out waste, and they balance fluid. When we need fluid, they keep it, and when we don't need it anymore, they release it into urine. So let's take a quick look at a kidney. Remember, it's retroperitoneal, so it's on the posterior side of the body. And just to simplify, this is the kidney, and these calyces kind of filter out toxins and balance the fluid. And the fluid and the waste is excreted into these tubes. This is the ureter, and it drains down here into the bladder, and then it's excreted in the urethra. So what do we need to know for our exam is that when the aging kidney does not clear waste as well and doesn't always balance fluids, or it doesn't always conserve fluids as we need them to. And last up is endocrine. So there's decreased activity oftentimes from arthritis or other physical issues, so not as much activity, weight gain, and decreased insulin result in type 2 diabetes. So in type 2 diabetes, as you age, can become common. Sometimes it's a genetic risk factor, and sometimes the environment, like physical activity and food. And last up is the terminal drop hypothesis. This is a presumed decline in mental function that's in the last 5 years before death. So just before death, there's a hypothesis. So somebody's thinking that they think this is what happens, is they just start to have a slowing of their thought processes. Okay, so that's all I have for the review for the exam. All of the information in lifespan development is important throughout the entire course, but this is just really focused on the exam. As always, let me know if you have any questions.